Hello, today we're going to go through interproximal reduction for your clear aligners treatment. We are going to go through some of the equipment that you might need and as well the steps to perform this for your patient. But first of all, it's important to know that you might hear designers or doctors referring to IPR in different names, such as interdental enamel reduction, slenderizing, stripping, selective enamel reduction, and also enamel reproximation. As well, it's important to clarify what IPR is. And IPR stands for the process of creating very small amounts of space between pairs of teeth in order to allow the teeth to move as needed during the treatment with clear aligners. In addition, this is one of my recommendations. Always keep a record when you perform IPR. Write it down in which specific teeth you reduce and how much you did. In order to track this, we are gonna see in a slide later where you can track your IPR with your full contour clear aligners. But first of all, we are going to see some of the benefits of the interproximal reduction, such as this is going to help you to address the crowding in your different cases. Also, it will improve your aesthetics and it will make possible to align properly the teeth while you're using the clear aligners. In addition, this will improve class and midline, and it will ensure that you are going to have a long-term stability of your results when the treatment is complete. So as I mentioned before, this is what you are going to receive when you have your full contour clear aligners. You have to check your treatment plan, and if you go under actions on treatment review, you're gonna be able to download this PDF that I'm showing you on my screen. You will have to follow the instructions, and as you can see here on the example, we will specify the amount of IPR that needs to be created, also the specific place, which in this case it will be between 21 and 22, and as well is gonna say the location. So always have this. If needed, you can print it out and have it in your physical RX for each of your patients. So now we're going to jump into the equipment that you might need. Some of this equipment is going to be mandatory. Some of them are not going to be mandatory. So I just want to highlight all of them. First of all, the IPR measuring gauges. As well, we're gonna have the IPR diamond strips, the mosquito burrs, and the diamond disc. These three options are going to be up to the treating doctor. You can decide if you want to use only one or if you want to combine this type of equipment in order to create the IPR. Of course, every single case is different. All of them are customized. In some cases, you're gonna have to create more IPR than in others. So this is up to the treating doctor. We will jump in the next one, in which we're gonna need cheek retractors. We might need a disc protection if we are using a disc as an IPR creation. On wax dental floss to check the tight contacts, and as well the topic anesthetic, which is a total, as I mentioned, not mandatory step. It's very important to highlight that all this equipment is available according to the regions. So it's important that you contact your representative in order to get the IPR materials. So we're gonna talk about the measuring gauges. On the measuring gauges, as you can see, we're gonna be able to verify the amount of interproximal reduction performed during this procedure. As you can see on the other picture, usually the set will contain 6 different gauges. This is another type of option that you can use as well. According to several users, this is safer and more accurate than using the different strips that I showed you before. This is up to the treating doctor if you want to use them, but as you can see, this curve and flex along with the natural contours of the teeth prevent the soft issues irritation and avoids cutting excessive material or enamel. Now we have the diamond strips that I showed you guys before. As you can see, we're gonna have in blue the medium diamond strips, we have in red the fine, and on yellow the extra fine. This is going to help to break the tight contacts. Now, as I mentioned before, some doctors like to perform the entire IPR with these strips, or some of the doctors will use a combination of these techniques by just breaking the contact with this strip and then keep going with a burr or a diamond disc. That is up to the treating doctor. Here we're gonna jump into the mosquito burrs, in which these burrs are gonna help you to do the IPR. You have to insert these diamond coated burrs into a dental handpiece for this to work, and you are gonna be able to reduce that enamel. As well, we have the diamond disc. This diamond disc is important to ask where you are buying them, because you can find them as a single size disc or as a double side disc. That will be up to your preference, and as well it's important to highlight that they're gonna come in different thickness. So according to those thickness, it will be the amount that you are creating of IPR. And I wanted to highlight this other way of doing IPR. I haven't used this myself, but according to the investigation, is a safe and precise and reliable method of doing IPR with this reciprocating system. According to what I read, it's more controllable and safer for the dentist to use it because it has protection, it has flexibility, so it will be faster and comfortable for the patient with this hand stripping. So now we're gonna go into the different steps. As I mentioned before, this is up to the treating doctor. This one specifically that I'm showing you on my screen is up to the treating doctor. Mainly, doctors with braces will use these rubber separators, but as well, some other doctors will use them as well with clear aligners. So, as you can see, you can use the rubber separators, and you can bring your patient back in 5 days or 7 days, and the space will be already created. You will have an open space to create more IPR or just to continue with your treatment. As a second step, we are always going to protect the soft tissues, which is why I place the cheek retractor as a minimize of risk while we are going interproximally and avoid any type of gingival damage. In addition, if you're using disc, or if you find for your strips or any other type of technique that you're using that you can add to the device any additional protection, that will be amazing in order to avoid any type of injuries. And this is as well not a mandatory step. However, for some patients, if we see that we are going to make any type of damage, we can always use a little bit of topical anesthetic gel to avoid any pain for our patients. As a step number 4, we are going to start accessing the interproximal spaces. So first of all, I always like to check between the contacts with unwaxed dental floss and be sure that constantly observe both the labial and lingual aspects to ensure that the teeth are not being cut inappropriately. This is under the treating doctor discretion how you are going to proceed with any of the anterior options that I mentioned to open the IPR space. Now, we are going to start by the reduction that is going to be performed either manual or mechanical, up to you. As I mentioned before, not every single case is going to be the same. Every single case is customized and different. And for step 6, well, we have seen that we can perform polishing after doing the IPR. As well, some patients might have like a slight tooth sensitivity when eating or drinking hot or cold items. Usually this is only temporary and teeth should return to normal within a few days. So by doing this polishing at the end, we are going to make sure that the corners are round and that we polish everything correctly. Now, for polishing, you can use a rubber cap, you can use pumice, or any polish paste that you find. And as I mentioned before, we can also add topical fluoride treatment, which is going to help with the little sensitivity that I mentioned before. So again, these will be the different options that you will do for your IPR techniques. And if you have further questions, you can always contact us. Let's change dentistry together. Thank you.